Hey guys, Dr. Eric, your fitness physician here with
Trainer Jeff.
how we doing?
How's it going, guys? Hope you're enjoying some of the workouts, some of the videos we're putting out there. I think we're putting, it's helping out. I have a lot of people that are messaging me on Instagram, Facebook. I don't use Twitter yet. I guess I need to learn how to use it.
Yeah, I don't use it as much as I should.
Yeah.
We've got a lot of good programs coming out soon too, guys. I've got a lot of people on some great peptide protocols. Obviously, the training, the nutrition workout plans that we put together are great, and even more coming out soon, so stay tuned. Guys, we're doing Q&A. Anything you want to know about nutrition, fitness, hormones, peptides, optimizing your vitality and health, let us know. We're happy to answer any questions you have. So I think Jeff has a couple that some of his clients have...
Yeah, so one of my clients, he's I think he's about 42, 43. He keeps himself in great shape. I mean, he works out 5 days a week. I finally convinced him not to work out 7 days a week. You got to have a little recovery. But he made the comment to me is, how do you know when your testosterone is low? And this is going to go towards guys. He said, I don't feel like I'm recovering. I feel like I'm tired. I feel lethargic. And I guess, is there kind of a checklist? I mean, I know the standard libido and different things, but he's tired and he eats very well and he works out. I know blood work is obviously going to be the what's going to tell you the most, but what are some things people can look for, some signs?
Yeah, great question. I get that all the time with my hormone optimization consults. And it's multifactorial. It doesn't necessarily mean it's just testosterone. Fatigue is a big one, and that could be your adrenal, cortisol, stress response is out of whack, you're not sleeping properly, your nutrition's out of whack, stress, a lot of things could be doing that. But let's just assume that all those things are in check, everything's good. One of the biggest thing with testosterone, with men and women, is typically those are some of the, that's one of the usually the cardinal complaints is fatigue, lack of libido, lack of morning erections, lack of sex drive. A lot of guys report decreased exercise endurance or capacity, like I'm just not recovering, I'm getting tired faster than I used to, I'm having trouble putting muscle on, can't get the fat off, I'm gaining weight, not losing it. A lot of guys complain, have mood abnormalities, just like women. They get cranky, they lose that drive, they lose that kind of get up and go. They're like, I just don't give a shit kind of attitude.
Is one of the signs bloating when you're working out? The more you work out, you keep bloating, you're not recovering? Or is
could be, yeah, but not typically.
So one of the things, I guess we've gone into it, and if this is going to be kind of a blunt way to put it, but when you wake up in the morning, if you're not awake,
right,
that's a sign that it's low?
Yes.
Okay.
That's one of the first things to go. That's like the canary in the coal mine thing. It's like, there could be an issue there. Yeah.
Okay.
Absolutely. So the ADAM score, they call it the ADAM, ADAM, androgen deficiency of the adult male. It's like a checklist that you can go through, and you can find it online. We give it to our patients too, but those are the most common ones.
And depression's a sign of low T as well, right?
Definitely can be.
Because
Depression,
the mind
anxiety.
So I guess the best thing to do is get a hold of, Dr. Eric, of course, and, get your testosterone checked, because when does a typical male peak at production? In the 20s, 30s?
Oh, and age-wise? Yeah. Oh, yeah, sure. In your late teens.
So when
20s.
you hit your 40s, like I'm in my 20s, but when you hit your 40s,
it can drop. I've had guys, starting to drop in the 30s and 40s. Typically, it's 50s, 60s, but nowadays in our toxin-laden society with stress and toxins in the air and the food and everything like that, xenoestrogens and things like this, it's affecting younger and younger. It's clearly shown statistically that guys are losing it at a much earlier age than our grandparents did, for example.
So give me your 3 top foods for boosting testosterone natural levels in the body.
That's a good one. Healthy fats.
Okay.
A lot of guys cut out all the fats. Make sure you're getting grass-fed beef, avocados, olive oil, nuts, seeds.
Yep.
Make sure you're getting enough protein. Healthy protein.
Right.
That's a good one. Probably the biggest one. And then carbs you have to be kind of careful with. A lot of people are on keto and things like that, but if you cut carbs too long for chronically, that can actually drop your T levels.
Really?
Yeah.
I never knew that.
Absolutely.
I'm a big believer in complex carbohydrates. I don't believe in the, being fat adapted as you. I think it has its place, and I think a lot of people are successful with it, but for someone like myself, I like to lift weights. I like to go in there, lift for a couple hours, and I like my carbs.
Oh, yeah.
But
it's a good thing to have.
But good carbs. We've talked about that.
Yeah. So those are some of the big ones. And some mineral things like people who have a deficient vitamin D, zinc, things like that. Those are common, and those can lead to
one of the
problems with testosterone as well.
So we'll get into it. I've had some clients have asked me this. I'm taking DHEA and magnesium before bed. But if you're low on T, it's not going to do much, correct?
No, those are great to take, and I take those as well at night.
But is it gonna, if you're low, it's not gonna.
It's not going to change too much.
Right.
Now, women DHEA can get a slight bump in their testosterone, but it's not much. But guys,
women,
it won't do too much.
You do get low on testosterone. I've had a lot of women say, "Well, I don't have Yes, you have a lot of it."
That's one of the first to drop.
When what happens is, if I'm right, your testosterone goes down, but the estrogen spikes, and estrogen's dangerous for women.
Well, it's
Too much.
Too much. If everything's out of whack. I mean, I
Right.
put a lot of women on estradiol that need it,
Right.
but progesterone and testosterone are the first two to drop, so they need it just as much as guys do. So, ladies, pay attention. You need T too, baby.
And
So
is one of the things one of the women said to me, a sign of a mustache? What is that? Is that?
that's a whole other conversation, but that typically is insulin resistance, which could
Okay.
indicate polycystic ovarian syndrome. And
Which,
that's
what
a
helps
very
that?
common endocrinopathy in women. So that's a whole conversation, but basically women have insulin resistance. It's a hormonal abnormality.
Okay.
So they need that to be
The reason I
addressed.
say that is we've had a couple females that I've trained that have come to you and you fixed that, and
Yeah.
that was one of the things that they, we could go on this all day long.
All day long.
So remember the 3, top foods for T. Get the healthy foods, healthy fats. Get some good carbohydrates.
And sleep. Make sure you're sleeping. Sleep is massively important.
Or nap every day. It's very important.
I like that.
All right, guys. Thanks. We
Thanks,
appreciate
guys.
it.
Have a great day.